Awesome. So welcome once again. Just giving a brief introduction. Kerkere for housekeeping. Please mute your mics on entry into the room so that you don't disturb the presenter as they're discussing. We're going to have time for chats at the end where we could ask some questions. That's when you can unmute yourself. Otherwise, if we're going through the presentation, feel free to use the chat box to ask your questions. And at the end, we'll be able to answer a few of them. So that's it from housekeeping. If this is the first time that you're joining our webinars, Wilvinakan, welcome. The whole point behind these webinars is to get these standard operating procedures circulated as widely as possible amongst the healthcare workers, so everybody's on par and everybody understands what's happening. Also understand that SOPs are a evolving document. As the crisis evolves, as new information comes by, we will be learning new things, and when we will continue to adjust these SOPs. So if you think there's things that need to be adjusted, please feel free to send us your comments, and we'll definitely have a look at them and consider them upon the next revision. So those are some of the SOPs that we have discussed. The safe return to work is the one we're presenting today, and that Dr. Kartika is going to be leading out with that. Tomorrow is also a very interesting one with the rapid diagnostic tests for COVID-19, and Dr. Alisha will be here to present that. So don't forget that tomorrow, 6 o'clock, we'll be presenting that one. But otherwise, today we'll be talking about the safe return of healthcare workers post-COVID-19 infection. I'm going to hand over to Dr. Kartika and the team, and she will take it from there. And you guys have a good rest of the evening.
Okay. Good evening, everybody. I'm Dr. Kartika. This part of the webinar is divided into two. The first one is the SOP, which is safe return to work for post-COVID infection for healthcare workers. And the second one is mental health and well-being for frontline healthcare workers. So let's start it off. This SOP was created by the Ministry of Health and Medical Services to ensure safe workplaces, especially for those returning after a COVID infection. It has guidelines to reduce transmission and maintain healthy operations. The SOP outlines the requirements to be followed when making decisions, especially in regards to a healthcare worker returning to work post-COVID. The scope, it applies to all heads of unit, especially to those who make decisions. This includes heads of departments, supervisors, managers, and team leaders. So people who need to know this are those in leadership positions and those who manage and supervise healthcare workers. Please note that the return to work is decided on a case-by-case basis, and this is in collaboration with infection prevention and control guidelines, individual risk assessment, and taking into account the healthcare workers' own preferences. There is a clinical clearance for returning to work, and so the first is for symptomatic patients, and this is those, so it's 14 days from the onset of symptoms, and the patient needs to be at least asymptomatic for 72 hours before clearance can be received. And for those who are asymptomatic, clearance is received after 14 days from the time they test positive. Please note that staff can experience symptoms beyond the period of infectivity. So you might have loss of taste, loss of smell, and that is present. Clearance is usually given by a medical officer, and that is again on a case-by-case basis. And it follows the following criteria. So the healthcare worker's general health and how severe their previous illness was, what their current physical presentation is. So if they have post-COVID fatigue or whether they are having any symptoms, their current mental health. So including whether they have any concerns or anxiety, whether they're able to concentrate. Note that those who've had COVID are at higher risk of muscle fatigue, anxiety, depression, and PTSD, and also the vaccination status for healthcare workers. So we have management responsibilities, and so for managers, they need to ensure that the following criteria is met. They need to assess the risk of the work location in context of potential future exposure to COVID-19. The second one is clinical conditions. So for immunocompromised patients, you would not allow a healthcare worker who is infected, has the ability to infect them to work, but once they have clearance and they're no longer infective, they may be allowed to work, and that is on a case-by-case basis. And the facility, whatever the IPC measures are, and the use of universal masking as per WHO advice. So for healthcare workers, we have responsibilities. And so firstly, you need to be updated on all COVID-related SOPs relevant to your role. Undergo any refresher training on IPC practices, including donning and doffing and hygiene. Follow the recommended public health measures. Monitor yourself for symptoms suggestive of COVID-19 and whether you need to stop working and isolate if needed. And then receive ongoing support and monitoring, whatever you need from counselors or your supervisors. There is a bit more in this SOP, and I've integrated that into the second part of the presentation. But the people who are responsible for making sure this SOP is carried out is management as well as healthcare workers, and it has been endorsed. So the second part of this presentation is mental health and well-being of frontline health workers. So when we have any sort of disaster, whether it's a natural disaster or the current pandemic, you have to understand that the psychological footprint always greatly exceeds that of the medical footprint. And so some of those footprints, some of those effects are felt quite late in life. And so you can have people who do have initial psychological distress, and it gets worse when this distress is long-standing and it ends up being a chronic mental illness, right? And that's why we're talking about this today. So COVID-19, so a systemic review of about 61 previous studies in other viral epidemics have shown that healthcare workers are at very high risk of anxiety, depression, acute and post-traumatic stress disorders, and burnout. And this is something that is also present in this current pandemic. Many workers globally have experienced muscle fatigue, sleep disturbances, emotional exhaustion, increased sadness, irritability, anger, and a general lack of happiness during the COVID-19 pandemic. The pandemic has led a lot of us to have poor work-life balance, and that's basically changed the balance between how much work we do and how much we put into our usual social and daily life. It has caused us to reduce the amount of exercise we do. There has been an increase in substance misuse, whether that's alcohol or cigarettes or other substances. And there has been an increase in screen time. And that may be due to the current modes, the telemodes that we use and the way we communicate. So all these in general have caused us to have an increased risk of anxiety, depression, acute and post-traumatic stress disorder, and burnout. And so acknowledging the stresses and its effects and putting into practice healthy coping strategies is important to help us better cope with COVID-19. So I think the first part of it is acknowledging our psychological stresses. A lot of healthcare workers with COVID-19 have been having changes in their work environment, and these changes are quite rapid. So a nurse today told me, she goes on break for 2 to 3 days. When she comes back, there are new work layouts, and these are all usually to help prevent infection. And so although these work environments, the changes are to help in the long term to prevent infection, it also causes quite a lot of stress because you are adapting to new environments constantly and you're not going back to a familiar environment. There are new protocols in place and you need to constantly update yourselves. Sometimes because you haven't updated yourselves or the protocols are new, there may be a lack of clarity about practices in certain places because of the setup of the workplace. It may be the workplace is quite poorly planned, or there may not be enough PPEs, which I know management is working on making sure that we get, but sometimes when you don't have it, that is a source of stress. A workload is another thing. So with doctors and nurses working in positive facilities, we know that they do work for 14 days or more at a time. And so you do not get enough that much time off. As well as that, with so many severe COVID cases, there is a lot of work that is done under pressure and with increased workloads. There is also a fear of getting infected at work and a fear of taking that infection back home to your family. Rumors, misinformation, overload of information is also things that stress people out. So constantly putting on the screen and all you're seeing is COVID. Family responsibilities. So you're, on top of COVID, on top of your usual work, you have your family and other responsibilities to take care of. And a lot of us, because we want to achieve the best we can, we may not be able to complete our family responsibilities. And that does upset quite a lot of us. There is a loss of routine and a loss of self-care activities. Physical isolation and quarantine, when you're alone in your room, that does become a bit stressful because you don't have anyone else to interact with physically and you're not going anywhere outside of those four walls. So that is hard. There's also a risk of relapse in pre-existing health conditions. So your diabetes, high blood pressure, your mental health conditions, and that may occur because you have put your work responsibilities first versus the stress is actually causing your body to become more, your immune system to go down. And the last one is when your efforts at work are not receiving enough value. And that's something we need to work on as managers. We need to appreciate what our staff do and give them a pat on the back, and virtually, obviously, when they do a good job. So psychological and behavioral responses to the pandemic. So, there is a range of responses that can happen in when you have such stresses. And the most extreme of which is psychiatric disorders. And this is something that we in a mental health clinic would be looking for. The disorder itself would be looking for signs of depressions. We would be looking for signs of PTSD, anxiety, and complex grief. But more often than that, you have other things such as distress reactions. And this is something that I know a lot of healthcare workers may go through, but never seek help for. And so when you're not sleeping well, when you're waking up every day at about 3 or 4 o'clock because your cortisol peaks, or when you have a lack of sense of safety in your environment or at home, when you have somatic symptoms such as you have dyspepsia or palpitations whenever you go to work, you're irritable, you are more prone to becoming angry, or when you're distractible, you're not able to do your job the way you want to. So these are things that are distress reactions, and they happen in quite a number of people. And all too often, healthcare workers do self-medicate or they brush it off, and that goes on to leading to a longer chronic illness. Or most people go into health risk behaviors, and that's substance use. So people depend on smoking or alcohol to cope. There might be issues that happen in family because of irritability or lack of coping. There might be a lot more conflict at home, and restricted activities. You might not be able to celebrate the things that you had planned to, and these all do affect. And then you have resilience. So resilience is actually a process of adapting well in the face of adversity, trauma, tragedy, and threats. And it's actually something that is built up over time. And that's a very long topic. But it comes, to get resilience, you need to have skills. And these skills include having confidence in yourself, connecting to those around you, being able to contribute to your work and feeling competent, having good coping strategies, and being in control of the things around you. And this is something that's built up over time. In stressful situations, people react in different ways. You need to realize that it's normal, because this situation is the abnormality. And it's normal to feel distressed, and it's normal to feel scared, and know that other people are also feeling the same thing. And sharing usually does help, and believing that it will be over at some point in time helps you cope better psychologically. So for mental health considerations, a part of this is taken from the SOP. So what are management responsibilities? As managers, I think we need to first realize that no man is an island. Just like anybody else, you need to look after yourself. You need to have good, healthy coping strategies, because if you don't, a lot of the times you will be distractible at work. You may overlook processes that need to happen, and you may react to a health worker's concern in a way that is not normal for you. You might be a bit more irritable and overlook things, or you might believe that I'm going through it and I'm coping with it well. Why aren't you? And so that gives us the tendency to overlook our responsibilities, right? So please do look after yourself. So going into health management responsibilities. Firstly, all managers, I request that you update yourselves and let that information trickle down to your staff. Be aware of the protocols and processes, know your resources and how to access them. So if you don't have something, know who to call to be able to access them. Be aware that COVID-19 infection on its own and does affect the ability of people returning to work. They might have long-term mental health concerns, they might be anxious to return to work, and these are things you need to be aware of. Support a flexible return to work. So talk to the employee and find out what the employee feels is manageable. So your employee might have long COVID or might have emotional stress. They might have fluctuating COVID symptoms, and you need to take that into consideration when they do come back to work. Consider a phased return, shorter work hours, fewer tasks. Give them more time to complete usual tasks, and see how you can adapt work to the healthcare employee. Have a supportive work environment. When employees come back, especially those who have experienced COVID, we need to make sure that they are welcomed back and we do not blame them. So be aware of your staff attitudes. Support seeking behavior is important. So consider having a buddy system at work, or if they need time off for counseling or an appointment, please adapt to your timetables. I know it's difficult in health, but I think we need to start doing that, because as a whole, we are a community. Establishing organizational support. So we do have, other than buddy systems and peer support systems, we do have counseling services, and I'll talk about it right at the end, and I'll give you some numbers for it. And if you need, or you notice that staff need a bit more help, you can always call us or call the counselors or for consultation. Rest and recuperation, try and allocate enough rest and recuperation periods for staff in the timetable as much as you are able to do so, and appreciate the staff. Like if they do a good job or they are working hard, tell them good job, establish a communication with them. So maybe a group fiber where you say good morning and give praise where it is due. Make sure staff are updated on changes in the work environment. They are aware of the SOPs, check in on this employee and see how they are doing, and respect confidentiality. So if a staff comes to you and tells you, I'm going through something really bad and I need help, please make sure that that the information stays with you and other people are not aware of whatever the employee has discussed with you. Also, consider how to manage staff who have long COVID-19 symptoms and arrange for planned reassessments of the healthcare worker. For the healthcare worker responsibilities themselves, as healthcare workers, we need to be, aware of what support is available and be amenable to receiving them. Be aware of your mental and physical health and communicate what workload is manageable. If you're having COVID-19 symptoms, if you're having issues with mental health, please seek help and take part in the buddy systems, the peer group that are available at work. So COVID-19 is a stressful situation for many people, and it is not a bad thing when you seek help. All right, so the general healthy coping strategies. So I've divided into 8 parts. The first one is boundaries. Set limits. So the limits, when I say limits, I mean look at yourself, see what you are able to cope with. Work, recognize that your fears are normal. It's normal to be scared of getting COVID-19. And you're only human and you need to admit to that. Hand over when you need to, too often. We have this attitude that it'll only be done right if I do it myself, or only I can do it. And that is not very healthy for you, because it means that you are at work a bit longer, psychologically as well as physically, and this is not healthy for you. You need to hand over, because that's why we do have handover. Be mindful of the distress you are absorbing from the patients. So with healthcare workers, sometimes, especially when family is not around, we are the only people who are there with our patients, and too often we see them in distress or they're scared of dying. And so we do talk to them and we do absorb all that distress. So be mindful of that and make the active choice to disengage when you need to, especially when you do go home. At home, you also need to set some limits for yourself. Be aware, accept that you might not be the perfect parent, the perfect spouse, the perfect child when you're at home. You may have some responsibilities that you are not able to do because you might be self-isolating, so you might not be comfortable going into the family area. You might not be doing the chores that you usually do. You might not be spending the time you usually do. And accept that it is happening and that it's okay. Also, so when you do have your rest period, when you have your recuperation period and you're safe to interact with them, as much time as you can with your loved ones, and whether this is physically or electronically, as long as you're able to interact well with them. Take a break from the news and the constant overload of information that you do have, especially at home. Like sometimes when we do leave work, we're still at home, we're going through all this COVID-19 news, and you need to set a limit on that. Right. And don't self-medicate. If you need help, please seek help. Don't take Valium or alcohol to cope with all the distress you're going through. The second one is routine. Create a routine that works for you. So during the work days, when you wake up, have a time where you can meditate or take part in self-care activities. You might have exercise routine, have something to eat or drink, shower, go to work. When you come back, have a checklist. So before you come back home, try and have a going home checklist. So the checklist would consist of 1, taking a moment to think about the day. So at work, before you're leaving, think about whatever's happened during the day at work. Acknowledge one thing that was difficult for you and try and let it go. Consider 3 things that went well, things that you did well. You were on time for work, you saved a patient, you talked to a patient well, you interacted with your colleagues, and give yourself a pat on the back, a self-pat. Check on your colleagues before you leave. Are they okay? Anything that you need to do before you leave? And check if you are okay. If you are not okay, talk to your supervisors. And then switch your attention to home and try and leave whatever problems you have. So one of the things that I've learned is try and imagine your problems as something, work, just leave it at the door before you come home. So when you come home, you're able to rest and relax. The third one is sleep. So a regular sleep routine will be very, very important. 7 to 8 hours of sleep each night. Avoid stimulants, caffeine and nicotine, so that you have a good amount of sleep. Studies show if you're doing a day shift, try not to have caffeine after 12 midday, so you have a good night's sleep. Stop nicotine at least an hour before you go to bed. Avoid electronics in bed. Make sure your bedroom is quiet and comfortable. And if you are having sleep disturbances, like you're not able to sleep well, try and, don't stay in bed longer than 5 to 10 minutes. If you're not able to sleep, get out of bed, sit on a sofa or read a book. And then when you're feeling sleepy, go back to bed. That way your bed becomes a safe place just to sleep, right? The fourth one is meals. Try and eat healthy meals. So lots of fruits and vegetables, nuts and grains, which actually help increase the amount of serotonin in your body and help you feel better. Keep alcohol, sweets to a moderation, right? Number 5 is exercise. Try and exercise at least 3 days a week. And I know with the gyms closed, not feeling comfortable going out, it is difficult. But with YouTube and a few other online resources, there are HIIT exercises on YouTube. There are yoga, Zumba, aerobics. And so you can put them on and try and go through them. And some of them are quite fun, but just switch on the music and dance like one of my colleagues usually does. You can try going on walks, especially early in the morning, and strength training. So the hardest part is starting. So just get out of bed and just tell yourself, I'm going to do it for 5 minutes. And usually if you're able to do it for 5 minutes, you can continue onwards and slowly build up to that 30 minutes, at least 3 times a week. For your environment, which is number 6, keep a clean and organized environment. Like remove things that are causing you distress. So if you have your bedroom and make sure it's calm, quiet place. Don't bring your work into your bedroom. At your workplace, keep it organized. So have things put in its usual place so you're not looking around. And that usually does help with the stress. Number 7 is communicate. You need to express yourself. Connect with your friends. You might talk to friends that you haven't talked to in ages. Talk to your family online. Talk to your coworkers. Just venting the feelings that you have usually does help. So one of the things that my colleagues do when we are stressed out or we are having an issue at work, we call someone and we talk to them. And that usually helps because the other person is able to listen to you, and just, having someone there to talk to you, to listen to you, usually does help. And so communicate with people. Number 8 is beware of substance misuse. I do know that a lot of us have unhealthy coping mechanisms, and that's usually alcohol and smoking, but try and cut down because it usually is not really healthy for you. Instead, you could try other coping strategies. So some of them that I really like is 1, build yourself a self-care kit, right? So have a box or a container and have a self-care kit in it. So a self-care kit would consist of things that invoke your five senses. So for touch, you could have a soft toy or a blanket there. For taste, have your favorite snack or drink, have some chocolate or whatever you like to eat. For sight, have a picture of a loved one or a vacation you took with your friends, some happy memory. For hearing, make a playlist of songs that you love and that make you feel good about yourself. For smell, have a scented candle or have air freshener or something that smells of happy memories. You can also put in other things. So you could put in a journal in there. So keeping a journal with prompts like write down one thing that made you smile today, or write down 2 things you're looking forward to. So if you write, that helps usually invoke happy memories. Also have a well-being plan. So write down how you're feeling today, what are signs of distress you're having, and who you would call if you are distressed, right? Have some puzzles, play games, and make a list of the movies you've been wanting to watch. Watch the TV series you have been wanting to watch. Listen to the songs, anime, books. Make a list of the recipes. And if you're living on your own or living, for example, at Elixir or something, you could just make those recipes and that would make you feel better. Or watch documentaries if that's what you really like doing. So these are a list of general healthy coping strategies. And you need to adapt it to things that make you feel good about yourself. So, but these 8 things are, kind of the guidelines where that you can use to cope, right? Getting help. So sometimes, even with these, you do need someone to talk to. And so there are a list of numbers that are available. You have Empower Pacific, which has a memorandum of understanding with Ministry of Health, and their helpline is 5626. You also have domestic violence hotlines, a child helpline, Lifeline, which is a toll-free line, and Alcoholics Anonymous. The number for St. Giles, the first number is the outpatient number, and the second number is the on-call registrar number. And so you could call us and we could link you up with somebody who can talk to you. As well as that, we do have a 165 number and extension 4, and that's usually between 1 p.m. to 4 p.m. Daily. And maybe in the future, we could consider a direct helpline. There is also psychological first aid, and we do have staff who are trained in it. And we are looking at, I think in certain places, I had talked to our director of nursing today, we had provided psychological first aid, but we could look at doing that in a more spread out manner. I think having a direct helpline for frontline staff is something we should consider. Yeah, so that's from me. I hope you were able to understand it. Do you have any questions for me or for our senior staff that are available today?
Please feel free to put your questions in the chat forum or raise your hand if you would like to ask a direct question.
I am mother.
From Dr. Nadeem, these numbers are not only for Suva, it's for nationwide, for throughout the country. For St. Giles, obviously we're based in Suva, but we are able to do some virtual reviews online, and we can talk to you on the phone when needed. So not from Dr. Kripali. There have been a few, but a lot of them are usually, so we do see them, and we make sure that whatever we do discuss, it remains confidential. So from Dr. Sapna, PFA is psychological first aid. It is a psychological tool that's used to help debrief those who have gone through trauma, whether this is primary trauma or secondary trauma. And so what happens is the patient, the people who have experienced trauma, they usually go through a process of debriefing about whatever trauma they've gone through. And this usually helps a bit in usually helps psychologically, and then we help in setting out healthy coping strategies for them. Oh, okay.
Hi, can I speak to that, please? Selena here.
Sure, Dr. Sure, Selena.
Selena Kurlata, working as a consultant with WHO, supporting wellness, Ministry of Health, in MHPSS, COVID-19 response. We've started the psychological first aid training, TOT, with the North last week. 6 hours of training, at the end of which you get points and certificates co-signed by WHO and Ministry of Health. Currently, Tava and I in process on working with the logistics for the West, and then Central, then Eastern health frontline workers, healthcare workers. So please, when your divisionals send out the invitation, please feel free to put your hand up. We will work around your schedule. For the North, we started with, we did the training from 6 to 8 p.m. in the evening, and just finalizing the complete list, because it appears that people wrote their names once, twice, and all of that. It looks like approximately a total of 100 people already in the West trained. Dr. Davina might want to speak to this a bit more, but our plan also is the cyclone season is coming up, and that's the other emergency that we're looking at. Psychological first aid is the first response that, or the first help that you give someone when a traumatic or a crisis event has occurred. The purpose of psychological first aid is to promote, protect our mental health, to ensure that we have a better mental health long term. Thank you.
Thank you, Selena. I just wanted to add, Dr. Kartika, I know that there's a lot of GPs also in on the presentation. And if FCGP would like to have us run a training with the GPs, requesting that FCGP send me an email so we can also coordinate that for the GPs. Thank you. Dr. Kartika, there's a question from Dr. Atishay regarding any insight on post-COVID neurological conditions that can complicate or confound mental health issues or conditions.
Hi, Dr. Atishay. So yes, there is. COVID-19 itself has post-COVID patients are at very high risks of getting anxiety and depression and PTSD. And we have been seeing it in St. Giles. We have been seeing patients who have had COVID, and then a few weeks after that, they're coming in with symptoms of depression and anxiety, and it does affect them. Also, patients with COVID have a risk of getting delirium, and that does, affect their medical condition as well. I hope that answers it a bit. For Empower Pacific staff, sorry, Dr. Nadeem, I'm not really sure whether they visit home to assess and review patients, but I do know that they do accept calls. And Dr. Pate was telling me yesterday that they are working on training Empower Pacific staff on, PPEs so that they can talk to patients in person.
Thanks, Dr. Kartika. I think Empower Pacific has been doing virtual sessions.
Yeah.
But we had requested for training in PPEs for them, as CWM is requesting for sort of face-to-face sessions for staff and their patients. So eventually Empower will go face-to-face, again with all COVID-safe protocols in place.
Thanks. So from Dr. Ellen, there is a handbook called Breathe, and it's quite helpful. So I'm wondering, Dr. Davina, how we can share it, because I have a copy of it.
Sure. If that copy, so if it's a copy that could be sent over to Liz's team, because we've grabbed everyone's email, I think, on the chat, and we could just circulate that.
Okay, so I'll send it to Liz. I have read through it, and I find that it's a really helpful resource, and it has helped quite a number of people coping with the mental health stresses. So I'll send it over to Liz, and then we can maybe circulate it to everybody who's given their email today.
Yes, certainly, no problem. And I can also circulate the Safe Return to Work SOP that you presented this evening as well.
Any data collected on the psychological advantages or disadvantages of work being placed? Sorry, Christine, your question, is there any data collected on the psychological advantages and disadvantages of work bubbles being placed in quarantine facilities while working. I apologize, I'm not aware of any data collected, especially in Fiji, but maybe we could take a look at that.
Okay. So, Dr. Davina, Dr. Carter, you just indicate when you're happy to wrap up the webinar this evening.
That's it. Thank you, Liz. I'm happy to wrap up now, if that's okay with everyone. Thank you so much for being around. So the SOPs will, I think, be sent to everyone by Liz if you've put your email on the chat. Yes,
That's right.
And we'll send the book that we were talking about earlier as well.
Okay. Dr. Katika, from everybody, I would like to thank you so much for this very comprehensive and insightful presentation this evening. I'm most grateful to you. Everybody, we have recorded this session. We hope to upload this recording to the Ministry of Health website, as we have done with a number of the other webinars that we have run in the last 3 to 4 weeks. So I direct you to the Ministry of Health website if you would like to listen to any of those previous presentations. Just for the remainder of the week, we have one webinar session that we'll be running tomorrow. Dr. Alicia will be presenting on antigen RDT. We invite everybody to join that discussion. And we, as we have done in previous weeks, we'll be releasing our schedule for next week on Monday or Tuesday of next week. We welcome any suggestions and presentations that you are interested in hearing. But if Dr. Davina and Dr. Kartika don't have any further comments, I'm happy to wrap up from here. Dr. Davina?
Thank you, Liz. Thank you from our end to the OZ facility for organizing these sessions. I think they have been really productive and provided great capacity building for our staff and those who have tuned in. I just wanted to draw your attention also to the question that Dr. Atishay raised, and I think Dr. Jennifer Hall has put in a link for managing neurological conditions and mental health conditions in COVID-19 patients. So it might be useful for people who are looking to find out more about neurological and mental health conditions. And Vinaka Vakalevu to everyone who's tuned in. Over to you, Liz.
Thank you, Dr. Davina. And once again, I would like to thank Dr. Kartika for her time in preparing this wonderful presentation, for other contributors, for the questions, and just generally for the support that people have provided and interest in this webinar series. So Vinaka Vakalevu to everybody, and wishing you a very good evening. Thank you. Good evening.